Everyone, this is going to be just a quick overview with this chapter reviewing assisting with the physical examination. Your textbook is going to have a lot more information, and you'll find stuff in the other PowerPoints that provides you with broader insight. But I'm just going to hit some key points as we go through this. So when you have a new patient, they're usually going to get a complete physical examination, which means the provider is going to go from head to toe, front to back, to kind of give us a baseline so we know if this person gets better, gets worse, just kind of get the whole general state of health. And it's going to help the provider do a diagnosis for this particular person. You'll also, as people come in, will have routine examinations that will be focused on a particular body system where they're having complaints. So here it talks about the different classifications. So we have a diagnosis, that's the identification of a disease or condition, and that's by looking at the physical signs and symptoms, their health history, lab tests, and anything else that we can get from the person. Clinical diagnosis, that's a record containing diagnosis based only on their clinical symptoms. Then a differential diagnosis, that's where we might have 2 or 3 things that they're considering that have similar symptoms. Again, this is what the provider is going to determine for the patient that is coming in. So you are going to be helping the provider by getting the medical history. You might be helping with the examination process, getting different instruments that they'll need, helping to hold the patient, put them in different positions. So you're going to be a component to the examination. Some basic instruments and supplies, gloves, applicators, tongue depressors, tape measures. So there's all different things that we will be using during the examination process. And this is just going to review a few of the most common ones, but again, your textbook and the textbook PowerPoints and other things, you might find some more. So a common instrument is the percussion hammer, reflex hammer. This is going to check the neurological reflexes, the knees, the ankles, wrists, elbows. It also mentions the Babinski reflex. That's where you're going on the sole of the foot. You could run a fingernail or something across the sole of the foot. In infants, you'll see their toes spread. If that happens to older children and adults, that's a negative. So that means it's something we don't want to see, that's abnormal. But in infants, it is normal for their toes to spread. Tuning fork, we will do this if you tap the tuning fork and then you can hear and you feel the vibrations. Now, we're not really listening for all the auditory stuff. We will use the audio scope, and we'll talk about that in a minute. But with the tuning fork, we will check other things, and it's where you'll see the provider placed against a bony part of the skull next to the ear. And this will come about in later lessons about the Rhine-Weber test, and you will have to be aware of those. Nasal speculum. Anytime you have a speculum is an instrument that enlarges and separates an opening so you can look and do an examination. So nasal speculum, especially if you work for an ENT, you might see this when they're looking in the nares. Otoscope and audioscope. So the otoscope, we're going to look at the tympanic membrane, which is the eardrum, and we'll be assessing if they have an ear infection, if there's a rupture, things like that. Audioscope, that's what you're going to utilize to help testing their hearing. Just an example of some of the different tools. Now, it used to be on the wall, but a lot of times what you'll find in the provider's office, they're portable, like that image there on the left. So you have your ophthalmoscope, which is going to look in the eyes, your otoscope that will look in the ears, but they might also use it to look in the nasal cavity. So you'll just see different things. And they have the speculum covers. You should always be using a new cover for each patient. This is a gooseneck lamp. It's a flexible examination lamp. Your responsibility when you are working with a provider is to make sure that the rooms are well stocked, that everything is in proper working condition, and you'll be assisting the provider as they are doing things. And so it might be handing instruments, it might be adjusting the light. So just be aware of that. Stethoscope is probably one of the most common tools that you will use in an office. Primarily, you're using the stethoscope for things like blood pressure. The doctor or PA or nurse practitioner, whoever, typically will be doing lung sounds, heart sounds. They might be listening over blood vessels for backflow of blood or anything like that. Bowel sounds. So there's all different things that we can use a stethoscope for. You'll see with a stethoscope, you have your earpieces. When you're learning, remember those earpieces should be pointing towards your nose or pointing towards the patient. That's where it then is going to, that sound will travel better through your ear and you'll be able to hear a little bit more. You see here, this is a dual head stethoscope. It has both a diaphragm and a bell. The bell typically we're using for cardiac sounds and pediatric sounds. The diaphragm, the bigger round flat piece, is the one that you would be using primarily for blood pressure. Pen light, we will use this so we can look in the different cavities. Typically the pen light though we're using primarily to check our pupil reaction. And so it's one of the common things that, and you'll see a acronym that we use later for PERLA, pupils equal round reactive to light and accommodation. It's a very standard that when we're assessing somebody's neurological functioning, we'll use a pen light. A laryngoscope, you probably won't see this in a primary care provider's office. These are used to help visualize the larynx, particularly when we're doing an endotracheal intubation. So if somebody's getting a breathing tube. Now sometimes in your ENT offices, they may have something like this so they can look at the back of the throat and the larynx. Vaginal speculum. So the vaginal speculum is again a speculum that will help the provider when they're doing things such as a pap smear or they're looking at the cervix and things like that. There are common, so you have plastic and you have metal speculums. And this is showing you some other tools that you would be using if you're assisting with a pap smear. It could be a cotton-tipped applicator, the histo brush, or the spatula. Those are different things that you may be handing a provider during a pap smear. Lubricant. Lubricant is a water-soluble gel that they will use for different things. They're doing a rectal exam, vaginal exam, something that would require a lubricant. It talks about bimanual. So there are times where they'll do a bimanual exam. And let's say if somebody's getting a vaginal exam, the provider might put a couple of fingers inside the vagina and then the other hand on top of the abdomen so they're pressing from both directions. In particular, you can do this to assess ovaries. So that's what bimanual means, using both hands. This and the next one is just going over some different scopes. Scopes are the tubes that have a camera at the end that allows us to visualize whatever area of the body that they're going into. So there's numerous types of scopes. These are all for the intestinal tract. If you work at a GI office, they might be scoped rectally, but you can use a scope that goes through the nasal cavity. We can do bronchoscopy, which is going into the lungs. So it really just depends where you're at with what type of scope. But it's a tube that has a camera, allows them to visualize whatever organs that they're trying to see. So just be aware of the different types of scopes. There's sigmoidoscope. So again, it's looking at the sigmoid colon. Now we're going to basic examination techniques, and you really should be aware of these. So there's 4 types of examination techniques. Inspection, that's where we're doing visual examination. Palpation, is where you're feeling something, you're palpating. Percussion, that's where you're tapping, all right? You're going to either tap directly or indirectly with your hand on top and tapping your hand, or auscultation, that's listening. So inspection, we're doing a visual examination of the body, the general appearance, movement, you're looking at the skin, membranes, and even smells is in here, but symmetry and asymmetry. So symmetry, it's equality on both sides of the body or with body parts. Asymmetry, remember when A comes at the beginning of a word, it means without. So this is simply lack or absence of symmetry. It's when we have something that's unequal. Palpation. That's where we're going to touch the body and we're going to feel. So you do palpate a pulse. But other thing that a provider will be palpating for: growth, organ size or shape, tenderness, moisture. So again, we talked about bimanual, that's using both hands, digitals, fingers, and manipulation is just moving a body part to test range of motion. Range of motion is, we consider how does your body move normally, your joints, and we might be testing it in passive range of motion. We'll be moving somebody's joint and never move it beyond a point of resistance or pain, or how they move. Sometimes people have limited range of motion because of an injury. Percussion, it's tapping of a body with a hand or instrument. So sometimes you're doing it directly over, just with your fingers, or the provider will have their hand and then they'll be tapping on the back of their hand that's on that body part. So what percussion is doing is we're trying to listen for if there's a thud or if there's a hollow sound. So they're trying to determine masses or air in that area. Auscultation is listening to sounds of the body. This is where we use the stethoscope, typically where heart, lungs, abdomen, blood vessels. But you can also auscultate by just listening to somebody, they're coughing or they're breathing. So you really need to know those 4 examination techniques. You help the provider with it, but the provider is the one who's typically running through all of these when they do an examination. You're responsible. Your responsibilities. The room should be clean, should be at an appropriate temperature, with light, ventilation. You should have the table disinfected, covered with fresh, clean paper, supplies are stocked, and your equipment is working. So your job is to prep everything in between all patients. So your basic job will be to call them in to the room or wherever you're going to do your initial interview with them. Treat them as an individual. All of this should really be straightforward, clearly, speak clearly and confidently, attain any history, and you're going to give them any direction that they might need. If it's for a pap smear, you're going to give them a give them a gown, or if they need to change out if they're having a breast exam, however it may be, you're going to instruct them what you need to do. You should always have the chart outside the room because it is their chart, but it's not for them to be going through. Okay. Now, if you're assisting the physician, your job could be handing instruments, supplies. If it's a male physician with a female patient, you're going to have to stay in, and then it might even vary depending on your facility policies. So make sure you're always following your facility policies with if you need to remain in a room during examination. You might help the patient into different positions, and you're there to support and reassure them. Okay. So your job, you should be watching the patient's face. You're going to see a lot more information than the provider uh, will be able to. The provider could be doing some sort of exam and they're visualizing, let's say they're doing a pap smear or something else, and they can't quite see the patient's face. So try to pick up on cues so you can share that with your provider. So these are just some of the different positions and what might be going on for the different positions. So standing, this is where they can observe for hernias. They're going to look at the legs. They're going to look at their posture, their gait. That's standing. You can do a lot of assessments with somebody sitting position. So head, neck, eyes. You can even start with the chest, the upper back, reflexes. You just need to be aware of these different positions. Supine is when somebody's lying on their back. So again, we can check out the chest, the abdomen, breasts. Okay. Dorsal recumbent. So this is where they're lying on their back, but their knees are bent and slightly separated. So we might do this for a vaginal exam, or again, checking for the genitalia and hernias. Lithotomy, and this is one typically that you're going to have somebody with their feet up in stirrups, and for a vaginal exam is the most common with the lithotomy position. Sims position is where the patient is lying on their left side. And again, we can do this for somebody, maybe for females for their genitalia. We can do this for rectal exams. And for the male, we can do this also for a prostate exam. Prone position, this is where somebody is lying flat on their abdomen. And again, you can, this one, observe the whole back. The knee chest position, this one, you can have them, so this is where your knees are bent and their bum is straight up into the air. So you can do a rectal exam, female genitalia, or prostate. Fowler position, so Fowler position, this one is, we consider this a high Fowler's when you're sitting at 90 degrees. That would be considered a Fowler's position. So this one, if somebody has, definitely if they have trouble breathing, we like to put them in a high Fowler's position because it helps with breathing and sitting up, so they can be observed with their neck, their head and chest. Semi-Fowler's is 30 to 45. So high Fowler's is 90, semi-Fowler's is 30 to 45, and you'll hear some textbooks which will say Fowler's position. I know the last screen said it, but a lot of textbooks, Fowler's is actually considered 65 degrees. So they're just some random, just depending on textbook. But just understand, so the semi-Fowler's is your head is elevated slightly, high Fowler's, you're all the way up. Trendelenburg, this is where your head is going angled down and your feet are elevated. A lot of times we'll do Trendelenburg if somebody is feeling a little shocky and their blood pressure has dropped, and this is what you want to put them in this position to increase blood flow to the brain and the vital organs. Your responsibilities after the exam, you're going to help them get dressed if they need to. You might want to also, if they've had a vaginal or rectal exam, there's use of lubricant, you can give them wipes. You're going to let them know the instructions that the provider might have about follow-up care, follow-up treatment plans, dressing changes, or whatever they might need to do. This is the time for education. So this is where patient education really is important, making sure people understand if they need to take their blood pressure, how they're taking pressure, what type of diet restrictions they have. So this is a very important time to be educating and making sure somebody is getting the education that they need. You really shouldn't rush people out during this process. You might escort them to the front desk, assist them with appointments. You're going to clean the room, disinfect, restock anything, and get the room ready for the next patient. Some general health guidelines, and I think your book has more, and please be sure to kind of review this. There are basic things that do come up on national. So I was just talking about you should have a physical exam every 1 to 3 years. Now, the PAP, that's really going to depend on a lot of different providers. Some will go every 2 years. If you have a history, every year. Some will say every 3 years. So it really just depends. A lot of times they like to start the pap smear after somebody's become sexually active. Breast exam every 3 years. Your first mammogram typically is between 30 to 40. It just, again, it depends on patient history. Baseline EKG, ECG, and EKG are the same thing, so it's looking at the electrical activity of the heart, should be at 40 years. Rectal exam, fecal occult blood at age 40, colonoscopies at age 50. Every 3 to 5 years, that will vary again based on history. Sometimes it might be pushed up to 10 years. And then for the men, this is all talking about the prostate exam. So the PSA and DRE at age 50. And lastly, some CDC recommended immunizations. Again, you're going to kind of check out your book for a little bit more information. Tdap once, but tetanus every 10 years, sooner if you have an open wound. MMR between 19 and 49 years. Now, you might have to renew your MMR. There's different protocols for that over the age of 50. Varicella, which is chickenpox. Typically, you get 2 doses. Seasonal flu, that should be done each year. Okay, pneumococcal over the age of 65. Hepatitis B for the adults. Most children, anybody born after 1985 would have been given Hep B at birth. There are some people who didn't have it, or it is possible you get your blood drawn and you have a titer to see what you're immune against, and that the Hep B vaccine didn't take, or you might need a new series. Remember, Hep B is one of the most concerning bloodborne pathogens for us in healthcare, so that is something that you would want to watch and make sure you actually have immunity for. And there are other recommendations in here, you know, that you could look at the shingles vaccine for those, I believe, over the age of 50, and just depending on what else you might come up in contact with. So these are just some basic recommendations, some general health guidelines and checkups. But again, make sure you're kind of going through your book and skimming through and reviewing some of the other information as it does come up on tests and quizzes. All right, and that is assisting with a physical exam.